Good afternoon and welcome to Facebook Live with Holy Cross Health. My name is Brenton Andrasic, Manager of Physician Alignment and Business Development at Holy Cross Health. Before we begin, I'd like to call your attention to a few ground rules that you'll see in the comments section. We encourage you to participate, but please keep any questions and comments general. We won't be discussing anyone's specific health situation in this public forum. If we can't get to every question today, we'll provide additional feedback through our website, or we can connect with you via phone or via our website. For those of you joining us today on Facebook, we thank you for being here and for taking an active role in your health, and we at Holy Cross are happy to be your partner in your health journey. We're here today to discuss a very popular topic, weight loss surgery. Joining us for this discussion are Dr. Joseph Green, a board-certified and fellowship-trained bariatric surgeon, and Julia Mutter, outpatient registered dietitian with Holy Cross Health. We all know that obesity is a major issue in our society. According to the CDC, over 42% of American adults suffer from obesity. And while not everyone who's obese is a candidate for surgery, we have seen a steady increase in recent years in the number of people turning to surgery for help. According to the ASMBS, approximately 256,000 people had bariatric surgery in 2019 alone, and that number is only expected to continue to grow. So Dr. Green, I'd like to start with you. Patients with obesity are frequently told to lose weight by exercising and eating right, but that often isn't enough. Can you tell us how bariatric surgery can aid in someone's weight loss journey?
Metabolic and bariatric surgery really is the only tool for sustained and effective long-term weight loss. It's backed by a substantial amount of data published in multiple medical journals, both in terms of reducing weight as well as reducing the comorbid or co-occurring illnesses that come along with obesity, like high blood pressure, diabetes, and sleep apnea.
And so, Julia, we should view bariatric surgery as just one part of a more comprehensive plan to achieve weight loss, correct?
Absolutely. We have a pretty comprehensive program here at Holy Cross where you'll be meeting with not only your surgeon, but a nurse practitioner, a dietitian, and also go through some lab work. And so you should see nutrition and lifestyle changes as part of your journey.
Absolutely. And Dr. Green, people sometimes talk about bariatric surgery as a last resort, something to try only when all else fails. Is that really how we should be thinking about this kind of surgery?
As I mentioned, bariatric surgery really is a very effective tool for helping people to lose weight as well as shed medical comorbidities. I think the biggest regret I hear from folks doing this later in life in their 40s and 50s, they didn't do it in their 20s and 30s and get those decades back. I think a lot of what we're feeling is stigma in society about the bias against bariatric surgery and the stigma about people who suffer from obesity. And I'm really glad that we get to talk about it today to remove that from the shadows and talk about how really a safe and effective tool can be brought into anyone's life who suffers from obesity and wants to lose weight.
And that's a really important point, Dr. Green. And to that end, who is a good candidate for weight loss surgery? Are there any restrictions on who should be eligible for it?
Well, it's been recommended by multiple medical societies that anyone with a body mass index of 40 or more, or with a body mass index of 35 or more who suffers from those illnesses related to obesity be recommended to have bariatric surgery.
And so you mentioned BMI. Is there a difference in the requirements that are set by guidelines by accrediting bodies for bariatric surgery versus guidelines from insurances to get this covered?
Yeah, that's a great point. Some of these medical societies even recommend bariatric surgery and metabolic surgery for folks who have a lower BMI, even down to 30, who are suffering from other conditions like difficult to treat diabetes. Although unfortunately, insurance companies won't cover those surgeries despite medical recommendations. Their cutoff is a body mass index of 35.
That's an excellent point for patients to consider as they go through this process. As we go through, we have a few questions that were submitted prior to the event today by people who pre-registered, which is always terrific. And so we'll address those as we progress. One of those questions was, is there an upper age limit for weight loss surgery?
That's a great question too. I always consider someone's active age rather than their chronological age in consideration for bariatric surgery. I would certainly say that folks, as they approach their later 70s, may get less benefit than those, as I mentioned, who are doing this earlier in life. But I think this is part of the individualized treatment decision that I undergo with every patient, where we talk about all the issues they're facing, how much weight they want to lose, and come up with the right plan for nutrition and eventually weight loss surgery with them.
And to that point about coming up with an individualized plan, we had several registrant questions come in advance that were specific to patient situations. So we just want to advise people who had very specific questions to take advantage of the information sessions that we offer. We'll have more info on that later in our discussion today. And as a result of those info sessions, you'll be able to connect one-on-one with our surgeons to determine what's right for you. So I don't want you to think that we are not paying attention to your questions, but we do want to keep the discussion somewhat general here today. So Dr. Green, could we perhaps explore some of the options for bariatric surgery that are available here at Holy Cross?
Currently, we offer the sleeve gastrectomy, Roux-en-Y gastric bypass, and the duodenal switch. Now, all these operations are performed in a minimally invasive fashion, that is, using laparoscopic or robotic surgery techniques, which mean all the incisions are only between 1/4 inch and 1/2 inch in size. They result in much less scarring, much less pain, and a very quick recovery.
And we had a question come in advance to say, how should a patient choose between a sleeve versus bypass surgery?
That is a great question I get all the time, and I would certainly welcome the opportunity to discuss that with any and everyone who's tuning in. It really is an individual decision, and we take into account a couple things. First, we talk about different issues that people are facing related to our health. There is some data to show that certain operations help things. For example, diabetes is helped better by a gastric bypass or a duodenal switch. We also take into account the matter of risk and reward that someone wants to assume. As the operations become more extensive, there's the opportunity to lose more weight and potentially shed more medical comorbidities. But we also have to discuss how much risk someone wants to assume in achieving those goals.
And that's a good point about the weight loss. Obviously, that's what we're discussing here. We had another question asking, will I lose enough weight with a sleeve versus a gastric bypass? Which one would I be more likely to lose more weight with?
I generally tell people that a sleeve gastrectomy can get off about 25% of their body weight. It's a bit more with a gastric bypass, probably 30 or so percent. A recent article showed at 10 years, a combination of the two is about 22.5%. But we see that 10-year data gives the durability of these operations and how long people are able to keep their weight off afterwards.
Another question that was asked was, is reversal possible for any of these procedures?
The gastric bypass is technically reversible. While in a sleeve gastrectomy, the extra part of the stomach is removed from the body, I like to say that in a gastric bypass, all the parts are still there, but the order is changed. And that reordering is what helps to improve, for example, things like diabetes. But I would also ask someone who's thinking about that why they would want to reverse an operation. And really what we're here to do is achieve lifelong weight loss and resolution of those medical comorbidities.
So we've touched on this a bit, but I was wondering if you could just expound on the idea of minimally invasive surgery, and then also talk a little bit about robotic surgery and how that's helpful.
Yeah, the field of laparoscopy and robotic surgery has expanded our capabilities into what is possible today. There's, again, a lot of stigma about what bariatric surgery used to be like in the era of open surgery, when people got a big cut along their belly. And that's all over. That should not be done in 2021 or 2022 and going forward. All of the incisions, as I mentioned, are less than 1/2 inch in size, and we pass long, thin instruments into the abdomen. Either in laparoscopic surgery, they're held by my hands, and in robotic surgery, they're held by a robot, and the surgeon sits at a desk at the side of the room and controls the robotic hands with hand controllers. Now, it's not like a self-parking Tesla. There's no automation. The robot does not do any surgery on its own. It's simply a way for the surgeon to increase their dexterity as well as their visualization of the abdomen. Whenever I open my hand, the robot hand opens. When I close my hand, the robot hand closes. And when I say hand, mind you, these instruments are less than 1/4 inch in size. And so the movements are very fine and very particular to assist me with the cutting and the suturing of the surgery. If the surgeon ever removes their head from the console, that's what we call the desk where the surgeon sits, the robot is frozen, nothing happens. It's a very safe and effective way to do surgery with great precision.
Speaking about safety, patient safety is real core value at Holy Cross Health, and bariatric surgery is a great example of that value put into action. Can you just talk a little bit more about safety and reliability of bariatric surgery as a whole?
I must say, I'm really proud that every month our team gathers and we track our outcomes. We look at our complication rates or lack thereof compared to other hospitals and nationwide standards. And we're really pleased to announce that we come in far below all the other standards of comparison. It really is a dream to be part of this program. The safety of bariatric surgery in general, I tell people, because of nationwide databases, every person who has bariatric surgery gets de-identified data put into a nationwide database to make sure that the hospitals that are doing bariatric surgery are safe and their outcomes are good, and those who aren't are remediated otherwise. We're on that short list of safe hospitals doing bariatric surgery, and we can defend that with our data. As far as outcomes, I mentioned resolution of things like diabetes, sleep apnea, high cholesterol, high blood pressure, arthritis. All of these things get better, and most of them can even go away with effective weight loss through bariatric surgery.
Yeah, and just to clarify, when you say far below comparison, that's in reference to complication rates and other similar things, correct?
Exactly right.
So we did have a registrant question that I think is applicable here. So someone asked, what's the most common complication of bariatric surgery?
I would say it's not really within the surgery itself, but the biggest challenge after surgery is maintaining hydration. Because the stomach has been made smaller, roughly 2 to 3 ounces in size, patients after surgery have to learn how to maintain hydration by taking small amounts of fluids continuously through the day. And that process can have a bit of a learning curve, but I think the excellent preparation that Julia and our nutrition team, as well as our nurses in the hospital, work with the patients after surgery and make them successful in their journeys.
Absolutely. And Julia, we'll get to you in a second. But one more question for Dr. Green. Where can patients have these surgeries performed?
I personally do surgery at Holy Cross Germantown Hospital. It's been a wonderful place to grow professionally, as well as a core group of people, a team that does exclusively this surgery. Bariatric surgery is also offered at Holy Cross Silver Spring Hospital.
And so, Julia, we've talked quite a bit about the surgery itself from Dr. Green, but so let's take a step back and think about how we prepare for surgery. So if a patient has gone through the process and decided it's right for them, where do they start in this process?
Usually, Dr. Green offers monthly or even, I think, bi-monthly classes to kind of introduce them to the surgery, and then they'll sign up for like a jump start to the pre-surgery diet. And we've written a comprehensive kind of nutrition guide that we provide patients with. And so we're not holding anything back, but we give patients just the pre-surgery diet, even the full liquid diet, and the diet progression post-surgery, all at that first class. And then as they prepare for surgery, we'll go into depth with that, maybe with their surgeon visits or with their visits to the nurse. We're all on the same page. And so that's how we get you started with your pre-surgery journey.
And what are some of the other steps that have to be taken as patients progress through that process towards surgery?
Well, one of the steps is just visiting with me as a dietitian. You'll visit with your surgeon, and also we have a great care team. One of the requirements of insurance is that you see a therapist, as well as draw labs. And I think Dr. Green has more steps that he's aware of as well.
So I like to divide the preoperative process into 2 parallel pathways that our patients go down together. The first is those to satisfy insurance requirements. Every insurance company requires a certain number of months of a weight management program. So a meeting with myself or Julia or our team in the office to discuss nutrition and fitness and how we're making strides in that regard. They also require a clearance letter from the dietitian as well as from a mental health provider. There are a couple insurance policies that have some other odd requirements, and we'll make sure that we satisfy those with you along the way. The other parallel pathway that we go down is regarding pre-surgical testing. So things like blood work, x-rays, and medical testing and clearance that's specific to the patient. So if someone has risk factors for sleep apnea, we're going to make sure we get them tested and a CPAP machine if necessary. If they've got cardiac risk factors, we'll get their heart cleared by a cardiologist before going under anesthesia. So that patients know going into the surgery that they've been thoroughly evaluated, they're going to go to sleep and wake up just fine.
So this is quite an extensive preparation process. What's the time frame for all of this to happen?
The time frame from start to surgery is regulated by the insurance companies for those who are choosing to use their insurance. For those who want to go outside of the insurance system, it's about 2 months, but the insurance companies generally regulate, and it's by policy, between 3 and 6 months of pre-surgical preparation. There are a few policies that have a 12-month restriction and some that require a certain number of visits without a time restriction.
We had a very pertinent question here. Someone asked, does COVID-19 impact the time frame for surgery preparation?
The COVID-19 pandemic doesn't particularly change the time frame, although if someone has been infected with COVID recently, there is a time from the onset of their symptoms until they can safely have general anesthesia. And that's part of the American Society for Anesthesiology guidelines, which we abide by. It's generally between 6 and 12 weeks on a case-by-case basis to evaluate individual symptoms. You should know that before anyone comes to the hospital to have an elective surgical procedure, including bariatric surgery, they have a COVID-19 test to make sure that they're not bringing COVID-19 into the hospital, either to infect other patients or put the operating room staff at risk. The hospital is a very safe place to have surgery right now.
It's a very important point to consider. Julia, I'd like to dive a little deeper into the idea of nutrition, especially in the preparation phase. How do we go about setting up patients for success with nutrition prior to surgery?
Like I said a little bit earlier, we do have a curriculum that we like to follow, but of course, because you're visiting with us usually one-on-one, we will talk to you about where you are in your lifestyle, like what your support group looks like, what your work day and even your everyday life looks like. And then we try to tailor some of our goals. We have some macronutrient goals, and we'll talk about the importance of protein, hydration, so that we minimize your risk for dehydration. So we try to make it a personal journey for each patient.
And could you talk a little bit more about the sort of diet plans that a patient might be expected to use in the lead up to surgery?
Yeah, typically we recommend a minimal amount of protein. We'll say 70 grams of protein, and we try to talk to them about carbohydrates and lowering their amount of carbohydrates. Oftentimes I'll ask patients to track what they're eating so that we can see where they are eating now and where we would like them to progress as they get closer and closer to surgery. And then as they get closer to surgery, there is a full liquid diet phase that helps shrink the liver to make it easier for the surgeons to perform the surgery. Some people think it's just for the GI tract clearance, but actually the 2 to 3 week pre-surgery diet really does help reduce those complications of surgery.
So Dr. Green mentioned that surgeries are performed both at Holy Cross Germantown Hospital and at Holy Cross Hospital in Silver Spring. We had a question come in that asking about surgeries performed by Kaiser Permanente physicians for Kaiser patients. They are performed at Holy Cross Hospital in Silver Spring. Could you just talk, Dr. Green, for a minute about whether there's any differences in the process for Kaiser patients versus your patients?
The process is largely similar. It's, again, generally a 3 to 6 month preparation involving nutrition education and pre-surgical testing specific to the needs of the patient and the conditions that they're suffering from.
So I want to talk a little bit about recovery and outcomes. We've talked a little bit about it already, but Dr. Green, let's say that the patient has decided surgery is right for them. They've gone through all the preparation that we just talked about, and the day of surgery arrives. How long does the actual surgery take, and then how long is the hospital stay?
Most operations are between 2 and 3 hours long, depending on the size of the operation and what we have to get done. Patients are up and moving that afternoon. Most of them tell me they feel better than they thought they did. Our patients generally spend 1 night in the hospital. We get some IV fluids and some blood work. and make sure the following day that they're able to maintain their hydration orally, taking small sips of fluids throughout the day. And then I generally tell them to take a week or two off of work if possible to really get the hang of things afterwards before diving back into life.
And Julia, what does someone's diet look like after surgery?
Typically, the diet right after surgery is it's the same as the pre-surgery full liquid diet. And so I tell people the better they do with the pre-surgery full liquid diet, then it'll be easier because they'll be familiar with it for the 2 weeks, the 3 weeks post-surgery that they're on the full liquid diet. And I'll usually meet with patients at about 2 weeks post-surgery, and it's our celebratory call where I talk to them about introducing food back in, and we talk about soft proteins and cooking their vegetables, but we actually don't even have a pureed phase. They can go straight into soft proteins and soft vegetables.
And Dr. Green, there's been a lot of research on the link between bariatric surgery and improvements in diabetes and other conditions after surgery. You mentioned it a little bit earlier, but I was wondering if you could just explore that idea for us a little bit further.
Yeah, the link between diabetes and obesity is very strong. Obesity puts us at almost a 400% chance increase in contracting diabetes. The two are very strongly linked. And losing weight through metabolic and bariatric surgery significantly reduces hemoglobin A1C levels, reduces insulin requirements, and many people are able to come off both insulin and other diabetes medications altogether. Recently, in the Journal of the American Medical Association, an article was published about the reduction in risk of adverse liver outcomes, steatohepatitis, fatty liver disease, which is quickly becoming one of the most common causes of cirrhosis in North America, as well as cardiovascular outcomes. What the study showed is that as people lost weight from bariatric surgery, the risk of having cardiovascular problems, heart attack and stroke, as well as adverse outcomes related to their liver and fatty liver disease all went down and stayed away.
Yeah, really just amazing research coming out about the benefits of bariatric surgery outside of just losing weight. It's pretty incredible stuff. We had a question come in asking, how much should I worry about GERD after getting a sleeve gastrectomy, assuming that there's no prior history of it?
That's a great question. We're learning because of all the data that we track. I mentioned the outcomes that are entered into a database. We know that a small percent of patients who have a sleeve gastrectomy surgery may get heartburn later on in life. And it can be for any number of reasons, between a hernia potentially developing in the diaphragm, potentially how the sleeve was healed, and also making sure that our portion sizes are still appropriate after the sleeve gastrectomy. But suffice it to say, there are medications that we can use to treat reflux after surgery, as well as procedures to even correct it. I wouldn't let that fear hold somebody back from pursuing their weight loss goals and health goals in other aspects. For most people, trading diabetes, sleep apnea, and high cholesterol for manageable reflux has proven to be a fair trade-off.
And I should have mentioned that GERD is GERD, gastroesophageal reflux disease.
Thank you, Brenda.
So another question about possible complications. Someone asked, what is the incidence of kidney stones after bariatric surgery and considering the modified diet?
It's not very common, but again, we are taking more protein and a lot of folks are supplementing with calcium. And so we make sure that our hydration is adequate. We're maintaining a brisk urine flow throughout the day. And most of those things can be flushed out before they even become a problem.
Another post-surgical question. Someone asked that, someone said some people who undergo these procedures lose a large amount of weight in a short period of time, and they wind up with some excess skin in certain areas. Can you just talk a little bit about body contouring after surgery?
I get that question all the time, and I try to remind people that this is not cosmetic surgery. Metabolic and bariatric surgery is life-saving surgery. We're helping people to lose weight so that they live long, healthy lives, free from diabetes, free from high cholesterol, free from heart disease. If someone has extra skin because they've lost so much weight after surgery, I tell them congratulations. They've done so well from surgery that I wouldn't let the fear of the skin hold somebody back. If it is bothersome after surgery, generally a year or so afterwards, once we've lost all the weight that we're going to lose, we can talk about plastic surgery and skin removal at that time. But I wouldn't let that fear hold people back really, let's use the tool that we have, these amazing operations, to lose as much weight and shed as many medical conditions as we can.
We did have a question come in the chat. Someone asked, if bariatric surgery isn't covered by your insurance, how expensive is it if you are private paying?
It varies based on how and when the surgery happens, but it can be between $16,000 and $22,000 depending on what operation someone is having. It's such an individual situation, though. I would love to take the time to explore it with that person in a one-on-one consultation. Of course, if someone's insurance policy doesn't cover bariatric surgery, which is, again, part of the stigma that we were discussing earlier, where insurance policies are allowed to remove coverage for bariatric surgery from the policies, generally, they have insurance coverage for other things like doctor visits, and we can do our consultation covered by the insurance as a normal physician consultation.
Speaking of that one-on-one consultation, Dr. Green, could you just talk a little bit about how patients typically find their way to our bariatric program, and then also just all of the different people that are involved in their care? We've talked about it a little bit, but it really is quite a team of people that are involved.
It's amazing. People find their way to my practice from all over, from our social media accounts. Feel free to follow me on Instagram, Dr. Joe Green, that's just Dr. Joe Green, through our Facebook page, through Google searching. And from there, we generally have an online webinar, as Julia mentioned, every 2 weeks so people can learn more about obesity, the risks to their health, and some different surgical options, as well as how they work. The second part of your question about the amazing team of people that we have working, they're all over and many behind the scenes. You've met Julia already, but I have an office staff of insurance specialists, a dietitian, a nurse practitioner, and a slew of medical assistants to help make sure that we keep patients on track. Based at the hospital, there are staff in the operating room, floor nurses, administrators, and people working to prepare our instruments and keep the operations flowing smoothly and safely. It really does take a village to do what we do.
Speaking of that village, Julia, could you tell us a little bit about our bariatric support groups for both past and for future patients?
Yeah, during this pandemic, we switched to a virtual support group, which our patients love. They don't have to sit in 495 traffic anymore. And we come right into our homes and actually my kitchen. So sometimes we'll do a cooking demo and people get to tell whether they're pre-surgery, they're approaching surgery, or they're post-surgery. And so it really does provide patients with maybe other people. Maybe they think that they're alone. They don't know anyone who's had surgery before. Maybe they have friends and family who have had surgery, but they still have a lot more questions. So our support group has a wide variety of patients, and we'd love for people on their pre and post-surgery journey to keep on joining us for that.
So before we wrap up here, we did have one more question come in on the chat. Dr. Green, how common is it to gain weight after bariatric surgery?
It's not very common, although a normal weight loss curve does entail a dramatic drop and a little bump back up, and that's totally normal for our body. I think everyone would probably be happier if the weight loss curve just came straight down to the point where we're going to end up, rather than going a bit below it and coming back to it. But I think success after surgery is really helped by maintaining connection to that community that Julia was talking about, by staying involved in our social media, staying involved in our support groups, and coming back to see myself and our office-based team regularly for follow-up, as well as checking vitamin levels to make sure that everyone's nutrition is right on point.
Yeah, I love that you mentioned that, because there are people in our support group who are 4 years, 5 years post-surgery and at a normal BMI. And I think a lot of the people in our support group get a lot of benefit from seeing them, that they still, even at a normal BMI, love the support from the group. They feel a kinship, and they feel a sense of community as part of people who have gone through that journey.
Well, we've covered a lot of information here today. Really excellent, interesting, fascinating stuff, but we're about out of time. So thank you, Dr. Green. Thank you, Julia. Thank you to everyone for tuning in today. If we didn't get to your question, we'll follow up with you after the event. And for more information about bariatric surgery at Holy Cross, and for information about upcoming bariatric surgery info sessions and support group sessions, please visit our website at holycrosshealth.org/bariatrics. So thank you all for joining us today on Facebook Live with Holy Cross Health, and we hope to see you again soon.